Does that mean I'm supposed to smile?
Yes. Think about the puppies.
There you go, the puppies. Good evening, everybody. Today is Tuesday, April 29th. I'd like to welcome you all to the DSS Board Meeting. We're here on the Out in East Starnes building. We're going to call the meeting to order. Let's stand and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And then we'll have our invocation by Reverend Kevin Burns from Water Life Discipleship Pastor.
So, I just want to say a few words about Mr. Burns. Thank you for joining us tonight and doing this for us. I know during the hurricane, during the disaster, his church as well as himself has been very helpful to our community, but also to our agency. I know one in particular thing that they were able to do was help us store some furniture for one of our employees who lost their house during the hurricane. And so they were able to, we found some donations through our committee, and Rebecca Baumgartner being a huge part of that, found some donations for this individual, and I know that they gave us a place to store those. And so for everything that you've done and your church, your previous church had done, we're very grateful. And thank you for being here tonight.
Absolutely. Let's pray. Father God, we thank you for this day. God, we thank you that we can come boldly and come humbly to your throne. God, we thank you for who you are. God, you are a sovereign God that is in control of everything and has a plan and purpose for everything. God, we may not understand. We may wonder. We may even at times question. But God, we are commanded to trust you, God, and we have, and we will continue to do so. God, as I think about the happenings over the past months, God, again, I thank you for this group. God, I thank you for this leadership. God, I thank you that they came alongside of those that were in a terrible situation, those that had lost a lot, those that were hurting. God, and provided support, provided a pathway to healing. God, I thank you for the community that came alongside. God, for churches, for other members of the community that partnered together to, again, help share love and show you to others. God, again, you command us to love you with all our heart, soul, and mind, and to love others as ourselves. God, and again, I thank you for opportunities you give us. Opportunities to not just say it, but to display it. God, and I thank you for leaders that you place in positions, just like here, the DSS. God, I thank you that as you care for the children, the least of these, God, you call us to do the same. And God, I do pray that you just give them wisdom, give them clarity, give them guidance moving forward on how to continue to help the community. Whether it be a tragedy, whether it be a hurricane, or whether it be just something else that's going on in circumstances. God, I pray that you just give them the guidance to know your wisdom in your way and be guided by your Spirit. God, again, thank you. Thank you for opportunities to reflect you. God, you are a great God that loves us, a great God that provided us, a great God who created us all in your image, but also a great God that gives us a pathway. And God, I thank you for all that you do, all that you've done, but God, all that you have ahead of us. God, we will continue to give you glory for all that you have ahead and as we walk in your Spirit. May everything be done and said bring you all the glory and honor in Jesus' name. Amen.
Amen. Thank you. So we will take a look at the agenda and any amendments that we might have.
So we do have a couple of amendments. Because we do not have a quorum tonight, we will not be able to make any decisions on any items. So because of that, item number 8, which is a decision item, we are going to go ahead and hear the report from Ms. Mary Patterson and Brandy Hood about our United Way agency agreement. We just will not be able to make a decision about that tonight. We will do that at a later time, but we will hear that report. We will also not be able to approve the minutes or the agenda, but we will go ahead and hear that.
All right. So should we just move to number 6, the Employee of the Month recognition?
Yes.
All right, so Miss Elizabeth Franklin, our Economic Services Manager, and Angela Clark from Adult Medicaid Services.
Good evening. So this is Angela Clark. She has been our long-term care Medicaid supervisor for a little over 2 years now. And she was nominated and chosen as our Employee of the Month for the month of April. And her nomination was by her whole team. So we as a team have decided to nominate this person as Employee of the Month because they possess all of the qualities that are needed to be considered an exceptional Employee of the Month. This person is compassionate about their job and ensures that all work is done timely and accurately. This person goes above and beyond to make sure that the team as a whole is succeeding, always stepping out of their own duties to ensure the entire team is striving. No one is left behind, and that doesn't stand a chance against her. This person is honest and reliable, always working long hours, weekends, coming in early, and fueled on McDonald's coffee to ensure their team is where they need to be. Even when the team has been short 3 people, this person kept everything running smoothly. Her team is more like a family, and there is never a question for any of the members if this person is standing behind them or not. We always know that she has our back. She values our families as she does her own, and we cannot think of a more important leadership skill to have than that. The entire team is all in agreement that Angela Clark deserves to be our Employee of the Month.
Wow, congratulations. Sounds like your team knows you very well.
I just have a good bunch of ladies I work with. They make it easy.
Well, we appreciate everything that you do. It's often that you guys are not recognized for the work that you've done, and so I really appreciate everything that you've done and the fact that your team is willing to point that out and have you come here today. So thank you.
Thank you.
Thank you.
And then we will do introduction of our new administrative officer, Ms. Caitlin Mundy, Administrative Officer 2, and Kim is going to do the introduction.
Yeah, you're welcome to come on up here, Caitlin. I'm just going to stay right here. No, I won't go anywhere. So I feel like Caitlin's been with us forever. I was just asking, like, is it time to introduce her? But I thought we had already done that because she just feels like, I mean, she fits in so well. It just feels like she's been there for at least months. I keep forgetting you just started April 1st. So Caitlin is in a position called our Administrative Officer position, and that is a reclassification of another position we had in the agency. And so what Caitlin is going to be doing and has already begun is really supporting administration in all of our program areas. And so not just supporting me, but also supporting Laura in Child Welfare, Brandy in Economic Services, Chris in Finance, or anyone else Beverly in Adult Services, anyone else who needs some extra support in maybe some activities that they're doing or studies that they're looking at or maybe trainings that they're having to ensure their staff are getting done. So she's going to be doing a lot of things that are very helpful to the entire administrative team. And again, I will say she's already begun to do that. She has already shown us that we made a terrific decision in offering the position to her, and we are very, very grateful that she accepted the position to be with us. And so just Caitlin Monday.
Well, welcome aboard. Welcome aboard. Kim, you let me know if you want to loan her out, right?
Oh, yes. She'll have a lot to do, so thank you.
Somebody's got to make jokes since Donnie's not here, so I'll try.
You're doing a great job. Great job.
All right, so the next item is no longer a decision item, but we'll move to a report around the United Way of Caldwell County Agency Agreement, and Ms. Brandy Hood, who's our Economic Services Program Administrator, and Mary Patterson, Customer Service Supervisor, is going to provide this information for us.
So I'm going to let Mary explain the United Way funding and how we use that funding. Every year we do this application. It's a grant that we have to do an application process for, and we just go over it with you guys to get approval.
Okay, all right. As she said, my name is Mary Patterson. I'm the Energy Supervisor. So as we know, United Way is an organization in Caldwell County, but they're one of our community partners. And so every year, as she said, that we apply to receive monies from United Way. So this year, we received $25,000, but we receive that in monthly allocations. So every month we get a check, I think it's $2,083.33. But the one thing, there's a couple great things, benefits for United Way, but let me take you back a little bit. We have two main programs, our Crisis Intervention Program and our LEAP program. Now, the Crisis Intervention Program is year-round, from July to June. The LEAP program is from December 2024 to March 2025. Now, with the SIP this year, Crisis Intervention, we exhausted those monies in October 2024. Now, we did have monies for LEAP when the season came in, but we exhausted those monies in January, the third week in January of 2025. So with our two major energy programs exhausted, how are we going to help the citizens? Here comes United Way. So we have a couple of other smaller programs within our energy program, and United Way is one of those things. A couple of great benefits for United Way is, whereas with our energy programs that are federally funded, there's some strict requirements, and they're income-based. But United Way, number one, it's not income-based, so anyone can apply that finds themselves needing some type of assistance, they can apply. And also, whereas the energy programs are only with the heating, cooling, which is your electric, your gas, your oil, your wood, but with United Way, we can help in many other areas. For water, for example, is a big part. Even rent, it may not be the whole amount, but anything, sometimes clients come in for anything helps and it assists. So, but with United Way, we give up to maybe 100, 150, depending on the circumstance, because each case is case by case, and we look at that. And sometimes it may be a little more, but we are able to just help in a variety of areas. And also, that's once a year, but saying that someone comes in, say for a water bill, and they only need about $50, $60, then they can come back in, if not to exceed, over 100, maybe 100, or a little bit more, depending, again, on the crisis, so whatever that is. So if someone came in today, they wouldn't be eligible for United Way again until April 29, 2026. So, but with United Way, it is one of the programs that really has bridged the gap of clients and families needing assistance this year, because this has been an unprecedented year where we ran out of monies and exhausted monies quickly, but United Way has been a great assistance, and we're able to assist those families that need something. And like I said, sometimes they just need a little something to help them, and United Way has been able to do that, and that's what we do with United Way monies. And again, it just covers a broad spectrum of needs instead of just one area. So we're grateful for United Way, and it does help our community and our agency a tremendous amount.
Thank you, Mary.
You are welcome. Any questions about United Way?
I don't have any questions.
Okay. Thank you so much.
Thank you, Mary.
Thank you.
All right, so continuing on with our other reports, we have the National Child Abuse Prevention Month, and Ms. Laura Harrison, our Child Welfare Program Administrator.
Hey, so as you may be aware, hopefully you're aware, April's National Child Abuse Prevention Month. You've seen the blue pinwheels hopefully out throughout the community, but up at our building. I'm not sure there's any out here, but we try to put those out throughout the community, and other agency partners put those out as well. So the commissioners this month did a proclamation for this as well for our county, as well as the governor did for the state. So just want to share a little bit of data, just very little today. Last year in 2024, Caldwell County received 1,724 reports of child abuse and neglect, and we investigated reports involving 1,056 children. So that's quite a bit that our county saw. And so with that is, everybody is a mandated reporter in the state of North Carolina. There's nobody excluded from that. Some people may not realize that. They're listening at home. It's not just professionals, it's everybody in the community. And so if you see something, say something. If you have any question about what's going on or suspect something, your job is not to go and investigate that. Your job is simply to report your concerns to us, to your DSS local office, and then that's our job to determine how to move forward with that. So we just want to encourage everybody that may be listening at home to please report anything that they may see or any concerns they have. Anything else you have? Do you have any comments or anything about that? Okay.
Thank you.
Thank you.
Right. And then we have Child Protective Services presentation from Crystal Henderson, our Staff Development Supervisor, and Leah Church, our Intake Social Work Supervisor.
Good evening. My name's Leah Church. I supervise intake, and this is Crystal. She's been here before to talk to you guys. So first, we're going to talk a little bit about our process of how things go with child welfare. And so we always get a call first through intake or sometimes a walk-in report. And in intake, we process all the reports of abuse, neglect, or dependency on children. Our intake social worker takes that information and logs it into about a 15-page document. There's all kinds of questions we have to ask into the child welfare information system. And when that's done, then they staff with the intake supervisor, which is often me, and we go through policy and see if that report meets the definition of abuse, neglect, or dependency. If it does not, then that report is screened out. We have to put a rationale with that report about why it doesn't meet the definition, and then that's as far as that report goes. If it is screened in, then it's assigned to an assessor who will either do an investigative assessment, which are on cases with physical abuse, emotional abuse, sexual abuse, cases like that, or a family assessment, which is more of our neglect cases. When it's assigned a time frame, so we either have to respond immediately within 24 hours or within 72 hours. And during that, we also make notifications to law enforcement when there's physical abuse, sexual abuse, or unsafe discipline that has injuries. We report those to the district attorney and to law enforcement so they can follow up on those as well. And so once we screen in a report, then it goes to an assessor and they go from there.
So at our agency, we have 3 assessment teams, and we have 5 workers on each team, so we have about 15 assessors when we're fully staffed. And so typically, once they've been fully trained, they go into a rotation. And so they just, Leah and her team, once the report is screened in, they just go down that list, and it's assigned to one of our workers. And so our workers get a mixed case. They may get those family assessments, or they may get the investigative assessments. And so they could be working either one of those. But they go out, they're the first people usually that families meet from our agency that they're getting that face-to-face contact with. But they go out to people's homes and they work with them for approximately 45 days. Sometimes we're not involved that long. There's times that we go out and we realize we're able to do a quicker assessment because maybe there's not as much going on with that family as what was reported, because sometimes we don't always get accurate information at intake. Or sometimes it can take a little bit longer than that, especially if we're having other partner agencies like law enforcement or sometimes the Robin's Nest, things like that. We're working with those children's advocacy centers or sometimes hospitals. It can take us a little bit longer than 45 days to be able to kind of assess that family and make a good, thorough decision about kind of what's going on in that family. And so while we're working with a family, if they go out and they're visiting with this family and they determine that abuse, neglect, or dependency has not occurred, then they're going to close their case. Now, they may recognize some well-being needs or something like that and refer them for some services while they're involved, but not things necessarily that impact the children's safety. But at the end of their assessment, if they determine that without intervention, then these children are likely to enter foster care, then we may make a finding of services, or we will make a finding of services needed. And those cases are referred to our in-home team.
So an in-home, they are the most intensive team. We have one in-home team and they have 5 social workers. We're down a position on that team right now, but they work the most intensively with our families. They, at a minimum for almost all cases, meet with the family 1 time a week, and that's everybody that lives in the home. They meet with them, and oftentimes it's more than that because they're working as hard as they can to prevent court involvement. And so there are times when that is unavoidable, and we will petition the court and ask for the court to order services in place, which the in-home team works on a family services agreement with the family, which lays out very clearly the department's expectation and also the family's expectation for us and what we can expect from each other to reach the goal of these children being safe in the home. And so if the family service agreement is not met, then we would either petition the court and ask that the judge order the family to comply with services, or if the children continue to be unsafe and the family services agreement is not being met, then we could ultimately ask for custody of the children to be placed with us.
And so not only through the provision of in-home services, but also sometimes in assessments, we always try to prevent taking custody. That taking custody from families is our absolute last resort. But sometimes we can't assure the safety of children, and that's what we have to do. And so throughout assessments, we may have to take custody, or through the provision of in-home. And so if the agency takes custody, then they'll work with one of our permanency planning social workers. Most folks know that as foster care. But they will work with families, and again, their goal is to reunify those children back with the families. And so they will work with families, not as intensively as in-home. It is less intensive than that, but they go to court a lot more. They have those court-ordered services, and there's kind of the expectation that families will work a plan within a year. That doesn't always happen, but that's sort of the expectation that we try to follow, is to get permanency for children within a year. And so hopefully we're able to reunify with families, but if we're not, then those children a lot of times may be adopted, or guardianship or custody may be given to a relative or a caretaker or something. Do you guys have questions for us?
I actually do have a couple of questions. You mentioned that the in-home team is down a staff. What about currently your intake team?
No, we don't have any vacancies in intake, and we haven't for quite some time. I'm actually coming back next month to go over a lot of data with you guys.
Okay. And do you guys have a standard, and I think maybe we talked about this last time, is there like a standard of how many investigations folks would be working maybe at one time?
Not necessarily. We don't have a standard number of reports. What we typically look at with investigations is more about how long have they been here, and is there are they ready for that? Because an investigation often requires a few more steps than a family assessment would, because the cases are more serious typically. That can change when we figure out what's going on, but they have to have been here and away from the training team for 6 months before we would even assign them an investigation.
Gotcha.
They do talk about caseload recommendations from the state. It's about 10
to 12
Yeah,
is
that's what
my
I'm
understanding.
I know they've looked at, they did a work study 2023, and they have changed some of that. It was 10 to 12. I'm not sure what the new recommendations are. It may be 8 to 10 now.
Maybe.
But, well, and historically, I think for the past several years, we've been within that.
Yeah.
Within our investigation assessment unit. So we've been fortunate in that area, I think, in regards to that.
Okay. And I guess the one other thing, especially because we have citizens listening, right, like, is about confidentiality. So when if I find something and I want to call you, sometimes folks are worried about the ramifications for that, if it's a family member or a neighbor. And so if you can talk a little bit about how that might look for somebody who wants to call but doesn't want people to know that they called.
Sure. So reporter information is 100% confidential. We never, under any circumstances, reveal that information to a family. And my staff takes care when typing reports that you're not able to identify with the way the report is typed who the reporter is. And so our workers, our staff in assessments, they also know when they go out there, we don't ever just read the report word for word. We go through and discuss everything and address all the concerns, but we don't ever disclose who a reporter is.
I will add, it's very rare. So if a case goes to court, the judge may order that the social worker disclose the reporter, but it's very very, very rare, because the judge is also cognizant of any ramifications that might come of that. And so it's a very rare case.
Right.
But that would be the only time that we would be able to disclose, and that has to happen in the courtroom while someone's on the stand being ordered to say that.
And so outside, though, of making the call to you all, typically after that, for the reporter, they're no longer involved. Do they?
So we're not able to give them any additional information, but we can call them back. They receive a letter. I'm glad you brought this up. So a lot of reports we get are people who want to remain anonymous. And if that's the only way they'll make a report, then we're going to take the report. But if they can leave us their information, then we can send them a letter. Then if they want to call back and follow up on the status of their report, we're able to give them that information. If they call anonymously, we can't do that because we're unable to verify who called. But if they leave their address and don't waive notification, then we can send them a letter with how we screen the report, and we also send them a letter at the close of the assessment on the case decision we made. And we can't, if they call back later, we can't give them additional information, but they can always continue to give us information.
Okay.
Yeah.
And I will say too, with reporters, sometimes what happens, I think, is we never disclose that information, but sometimes because of what's reported, families can often deduce to figure out this is likely where this report come from. You know, if a child's at the hospital and we show up at the hospital, they're probably going to think, well, the hospital called DSS. And so I just say to people, you know, assure that we are not going to tell them, but sometimes families can kind of figure things out, or they may think they figured it out and accuse somebody that did call the report, but we did not share that information. So.
And we don't confirm or deny either way. We'll oftentimes go out and the family's going to say, well, I know it was my grandma that called. And our response is always, we can't confirm or deny who the reporter is. So,
Okay. Thank you, guys.
thank you.
Thank you.
All right, and then we have our monthly updates. And so our financial report from Chris Conley, our business officer.
Good afternoon. Our March financial report, our reimbursements totaled just over $712,000 for the month. We ended the month with receivables of about $1.6 million. Expenses in the month totaled $1,570,054. So our county dollar for the month came in at just under $858,000. The total expenses and county dollar amount is a little high for a normal month, but during March, the state drafted back from counties some of the hurricane relief funding for those counties that have not been able to utilize it, and unfortunately, we've not utilized some of it to the degree that we had hoped, simply because the restrictions on using the funding have been pretty hard to work with. I don't remember the amount that was drafted back, but it was probably around $150,000 between the child resources and adult resources funding. So again, making our expense total and county dollar total for the month higher than normal, because all that funding had been received, in the weeks following the hurricane, and had gone into our budget as an unbudgeted revenue. Well, now they're drafting it back, so it shows up as an expense at that point, although not truly an expense. It just washes against that initial revenue. So in our year-to-date comparison to prior year, expenses are up just over $1.3 million through March. Revenues are up about $650,000. Therefore, our county dollar is up just under $669,000 year-to-date. And last week, we provided you with pretty detailed explanation on that. So I'm just going to kind of summarize and not go into all that detail today. But, the county dollar is up at that level simply because of decreased revenues in administration and foster care out of our control. along with increased expenses primarily in administration, also out of our control. If you have any questions about the explanation, I'll be happy to go further with it.
I don't have any questions. You sent a nice detailed report
Okay.
about what that looked like.
And if you have any questions about the report as a whole, I'll be happy to try to answer them.
All good.
All right, thank you.
Thanks, Chris. And then Director's Report from Ms. Kim Arnett.
Sure. Let's talk about the personnel report first. We had a couple positions that have vacated since our last meeting, and we have filled double what was vacated, so that's a positive. We are still working to fill the positions in our permanency or our foster care area. We did get the 4 temporary part-time positions approved by the commissioners, and thanks to the support from the board as well, we have hired 2 of those positions, and those individuals have had previous social worker experience with our agency. So they've come back to help in this area, and we are still trying to recruit for 2 more. And hopefully that those positions will take some of the load off of our full-time staff until we get to till we get fully staffed. So nothing else really to highlight with our personnel report. I will want to talk just a minute about some outreach that we did recently. Jarrell had asked us last month to come to the hospital and meet with a few of their case managers. And so we did that on April the 15th. It was myself, Caitlin came with us. It was Laura came with us to talk about child services, and Beverly came with us to talk about adult services. And Crystal Henderson also accompanied us in this meeting. And we sat down with about 4 case managers, and then Jarrell also joined us just to talk through some of our policies, our statutes, the guidelines we have to work within, and then also for them to talk to us about situations that they've encountered, things that are common, some that aren't common, but they've seen happen, and giving them a chance to ask us questions about some of the decisions we have to make, some of the things that we have to do, and vice versa, for us to ask them questions about what some of their practices are. It also gave us a really good opportunity just to put a face with a name and establish a relationship with these individuals. And I know Adult Services has worked with Bethany at the hospital quite a bit, and they have a really good working relationship. Some of the other people are new and we haven't met face to face, and they haven't met us face to face. And so I thought that was a really good opportunity for us to be able to sit down and have those conversations. So I thank Jarrell for kind of making that happen, and of course thank you to all our staff for going there and having those conversations. I think it went really well.
Yeah, I always find that things, they don't always go like we hope they're going to, but if we have an explanation and a relationship with the person that's delivering that information, it makes it a lot easier to just understand why.
Right,
So.
exactly. And that's all I have. I know Leah mentioned briefly she's going to have some data for you next month. I think Laura might actually talk about this a little bit, but Donnie had asked for some data, and so we're going to be bringing that. We were going to bring it this month, but since Donnie's not here, and I know that's something he wanted to hear, we were going to wait till next month to talk about that.
You have anything else? No? All right, Children's Services, Mrs. Laura Harrison, Child Welfare Program Administrator.
Well, Kim stole my thunder there.
Just that one thing.
No. Okay, it's showing. So I won't read the numbers out loud. They're up there. And just go down. You'll see that our assists did go down. It's about the only thing that's really a big difference that you'll see. That just means other counties for month of March did not ask us to help them. Yeah, it was quite a bit. So And like Kim said, we did took a lot of time and dug into all that data, and we'll have that to present next month for you guys. I will say, just a reminder, or as you've maybe heard me say before, PathNC, our new system for child welfare, is rolling out, going live on 6/2. That's been in the works for a while now, and it will replace maybe what you've heard referenced to as NC-FAST for us. Now, NC-FAST will remain for economic services, but our new system will be PathNC. We have training next month for that, for our staff. We are a hosting site for other counties to come as well for that in-person training. We are going to be very busy next month. We have that training. It's a 4-day training that each of our staff must attend. We also have other training that's happened this month and will continue to happen next month with our new, they're called SDM tools, structured decision-making tools. And those are just additional things that help us guide us in making decisions on cases. And those are all new that the state has rolled out at the same time as the new system, as well as we also have new policy that will take effect on, I think it's May 12th. And so that's coming out. I think tomorrow we get to see the actual policy written. And then we have a webinar type thing that they go over with us. So we get to hear about it. So just a lot of changes happening right now, very busy, on top of, other things, these things on top of our normal duties that we have to do. So just, if you come by, you may see us just running around crazy, but just to let you know that that's what's going on with us right now. Do you have any questions or anything?
I'll just add to the public who's watching, because this is all going to be new, if someone does call in a report, it may take just a little bit longer for them to get through that process in the beginning, because it is going to be different. Now, hopefully, it'll be more efficient, and as we, as the staff get into this system and learn it, the hope is, and the plan is, that it is more efficient. And so we hope that is the end result, but just knowing that getting there will take some time.
Yeah. Thank you.
Thank you. All right, and our Adult Services Report, Ms. Beverly Rupert, Adult Protective Services Manager.
Hello. You should have a copy of the Adult Services numbers. March, our screenings were a little down. Special Assistance in-home, we 3 more cases added to that. That's the one that's really growing fast. Everything else is pretty much about the same. Adult home specialists, we didn't have any reports called in, but even though it says 0 reports called in, there are still reports that worker is working. Does that make sense? Any question about our numbers? Pretty good. Okay. We, of course, I'm gonna mention this again, and I will mention the results next month. Celebration of Life is this week. Woohoo! Friday. We're expecting a good turnout. We normally average about 20 to 21 vendors. This year we're going to have 30, so I'm super excited about that. Super excited about setting up all those tables. But so that is Friday, just as a reminder. Celebration of Life is May's Older Americans Month, and that's how we recognize the seniors of Caldwell County. It's free to everyone, 60 and over, meal, entertainment, and an informational booth there. Okay. And then I wanted to briefly talk, we over the past year, when Kim became director, we started this, we call it the Guardianship Blitz, where we meet monthly and we talk about our clients that are under our guardianship. And yesterday when we were talking, we were going over the numbers of how we've been able to help this program. And I kind of wanted to touch on that. Guardianship should be, the state's really pushing for least restrictive. It's called Rethinking Guardianship. And becoming someone's guardian should be the last resort. Everything should have been done to make sure there's not a least restrictive way to where you don't have to go to court, whether it's a POA, a payee, look at other least restrictive things instead of having to do guardianship. Now there is times where we do have to do guardianship. Well, once we do guardianship, DSS really should be the last resort. We should be only named guardian when there's no one else. So what we have been doing is we go over the guardianship cases monthly. In the past year, due to us meeting and really digging into these cases, we have been able to modify 6 guardianships, which means they are no longer under our guardianship. We have been able to modify, and family members have taken over that role. And we've also been able to restore competency to 1 client. So that that's a really big deal. And a lot of times, we're appointed guardian because the family doesn't want to step up and be the bad person. So a lot of times, once we get that guardianship and we get everything stable with the client, then a lot of times the family will step up and be guardian, and then we can modify the motion. And that's what we're finding out has happened with these that we're reviewing. We're notifying family members and we're talking to them, and they're stepping up and wanting to take the clients and be the guardian.
If you think about that if we look at our guardianship cases right now, that's 42 people, and so that's around 14% of the people we have now. And so that's I think it's a big deal. And, what Beverly's talking about, and people not wanting to be the bad guy, it's very hard to make a decision to place your family member in a facility when they don't want to go. And so sometimes it's hard for that family member to do that. And so then when we end up getting involved and being able to find that placement, and then you have that adult who is doing well in that placement, everything is settled, then a lot of times, like she said, that family member will say, okay, I can do this now. And that's what we want. We don't mind helping, and we don't mind doing that. Of course we will. What we really like to see is when family members, friends, people who care about these folks and have that personal relationship with them, be that guardian. And that's what we want. That's what that person would want. And that's what the state also wants.
One of the best cases, I think, we've had this person as a person under guardianship probably for about 15 years. His sister had been his guardian, and he had a lot of mental health issues. Well, he was living with her. It got to where she couldn't do it anymore. She motioned it in. We became the guardian. He's now been in placement for, 10 years. He's doing amazing. He's stable. And she kept in contact with him and sees him and everything. But we just made that phone call to her about, how are things with your life now? How are things now that he's settled? And she was ecstatic to get the guardianship back. She said she didn't know she could do that. So we were able to modify, help her in a time of need, and then give the guardianship back to her. So that was
Do we know, so you guys have 42, do we know how many, are there other folks who are in guardianship with other agencies that are not managed by DSS?
We contract, we have 8 clients with Hope for the Future. We contract with them. So we have 42 that were guardianship, 8 that we contract with Hope for the Future.
Okay.
Now that 42, as you can tell, it fluctuates constantly. But yes, we do contract with Hope for the Future for 8 of our wards. And the reason we do that, those 8 have major mental health issues, and Hope for the Future is in Asheville, and they have a little bit more resources to be able to best meet their needs.
Thank you.
Anything else? Okay, thanks.
Thank you.
I'm glad you reminded me about Friday. I just got back from vacation on Monday, so I'm still at the beach and had not forgotten, but. All right, Family Support Services highlights, Miss Brandy Hood, who's our Economic Services Program Administrator.
So the numbers should be up on the board and also on the screen for anyone at home. I'll just highlight a couple areas here. Our child care services the number of applications received is still very low. We're still currently on a waiting list. We're just waiting on some more funding clarification to see about removing children from that list. Another thing I want to highlight is our emergency assistance program. You see that the total services paid out has decreased again this month, and that will continue to decrease until we receive our new allocation of funds in July. Any questions about the numbers?
No, we don't have them in here.
They don't have them in their packet.
Oh, you don't?
I don't think so. Do you have one? I see it up there, but I don't see it in here.
I have this one.
Oh, maybe it's over here. No, that's okay. I'll get one in.
Okay, I can give you this copy.
That's fine.
And just some highlights from our area. I want to highlight one of our child support agents, Erica Dula, for she got a shout out from the state for her total collections that she received in the month of March. She received, for one case, a little over $9,300 for that case. So they gave her a shout out, and we would like to give her a shout out as well for all of her hard work. For our program integrity unit, we are now starting, which we have done this in the past, we just haven't done these very frequently. And with COVID and all the guidelines that went in place there, we have slowed down on this. But with program integrity, we are starting back our home visits to complete interviews with households. This is part of policy. We have had a little bit of friction with this already, but we did want to announce that will be starting back. One last thing is the Medicaid waivers are looking at lifting as of 6/30. One of the main ones that will cause some additional work for a couple of our areas is the requirement to cooperate with child support. That will be starting back as of 7/1. So that will increase the workload for Medicaid and, of course, our child support enforcement. They also are looking at some additional waivers to add, and those would be continued eligibility for children. And for the first area, it will be birth to age 5 up until the month they turn 6. They will get continued eligibility for that whole 5 years. And then the next waiver, they're looking at ages 6 to the month they turn 19. And they will get a recertification. They'll get continued eligibility for 2 years. So they'll get recertified every 2 years. So we're thinking that will definitely help with that population. Any questions?
I don't have anything.
Okay,
All
thank
right.
you.
Thank you. Anything else?
I have nothing else.
All right, so our next board meeting will be Tuesday, May 27th at 5 o'clock here in the Aldine Stearns building. We will adjourn the meeting. Okay. It's just hard to see the numbers up there.